Good evening everyone. I am Diane Garjola and we are the Group 1. We will discuss about Chapter 9, Demonstrate the emergency in the different situation during the tour. Learning objective. First is discuss the demonstrate the emergency in the different during the tour. Second is demonstrate the different emergency drill. Third is a step-by-step visual guide to performing CPR. Using the CPR step on someone who is not breathing can help keep them alive until the emergency service arrives. CPR works by keeping a person's blood flowing until healthcare professionals can help them. People without first aid training can still save a life by using the CPR step. When a person initiates CPR immediately after someone's heart stops beating, CPR can double or even triple the chance of them surviving. We provide a step-by-step visual guide to performing CPR. First is call 911 or ask someone else. Second, lay the person on their back and open their airway. Third, check for breathing. If they are not breathing, start CPR. Fourth, perform 30 chest compression. Fifth, perform 2 rescue breaths. Last is repeat until an ambulance or automated external defibrillator arrives. Chest compression. For adult, press down 2 inches. For a child, press down 2 inches. For a baby or infant, 1.5 inches. This is the circumstances when a person needs a CPR when they are stopped breathing. First, cardiac arrest or heart attack. Second, choking. Third, a road traffic accident. Fourth, near drowning. Fifth, suffocation. Sixth, poisoning. Next is a drug or alcohol overdose. And is a smoke inhalation. And is electrocution. Last is suspected. This is the before giving CPR. First, check the scene and the person. Second, call 911 for assistance. Third, open the airway. Fourth, check for breathing. And next is the Red Cross CPR step. First, push hard, push fast. Second, deliver rescue breaths. Third, continue CPR step. First aid. Cardiopulmonary resuscitation. First aid is a life-saving technique useful in many emergencies, including a heart attack or near drowning, in which someone breathing or heartbeat has stopped. The American Heart Association recommends that everyone untrained bystander and medical personnel alike begin CPR with chest compressions.
Here's advice from the American Heart Association. First is untrained, second is trained and ready to go, and the third is trained but rusty. Before starting CPR, first is the environment safe for the person? Second is the person conscious or unconscious? Third is if the person appears unconscious, tap or shake his or her shoulder and ask loudly, "Are you okay?" And the fourth is if the person doesn't respond and 2 people are available, have one person call 911 or the local emergency number and get the AED if one is available, and have the other person begin CPR. And the fifth is if you are alone and have immediate access to a telephone, call 911 or your local emergency number before beginning CPR. Get the AED if one is available. And the sixth is as soon as an AED is available, deliver one shock. If instructed by the device, then begin CPR. Here are the demo of remember to spell the CAD. First is the open pop-up dialog box is the chest compressions, and the second is open the airway, and the third is, and next is the compression restore blood circulation. First is put the person on his or her back on a firm surface, and the second is kneel next to the person's chest and shoulders. Third is place the heel of one hand over the center of the person's chest between the nipples. Place your other hand on top of the first hand. Keep your elbows straight and position your shoulders directly above your hands. And the fourth is use your upper body weight, not just your arms, as you push straight down on the compress the chest at least 2 inches approximately 5 centimeters but not greater than 2.4 inches, approximately 6 centimeters. Push hard at the rate of 100 to 120 compression a minute. The fifth is, if you haven't been trained in CPR, continue chest compression until there are signs of movement or until emergency medical personnel take over. If you have been trained in CPR, go on the opening the airway and rescue breathing. Next is airway, open the airway. If you're trained in CPR and you perform 30 chest compression, open the person's airway using the head tilt, chin lift maneuver. Put your palm on the person's forehead and gently tilt the head back. Then with the other hand, gently lift the chin forward and open airway. And next is breathing. Breathe for the person. Rescue breathing can be mouth-to-mouth breathing or mouth-to-nose breathing if the mouth is seriously injured or can't be opened. Next is to perform CPR on a child. The procedure for giving CPR to a child aged 1 through puberty is the same as that for an adult. The American Heart Association also recommends the following to perform CPR on a child. The second is compressions. Restore blood circulation. If you are alone and don't see the child collapse, perform 5 cycles of compressions and breathe on the child. This should take about 2 minutes before calling 911 or your local emergency number and getting the AED if one is available. Next is airway. Open the airway. If you're trained in CPR and you perform 30 chest compressions, open the child's airways using the head tilt chin lift maneuver. And next is breathing. Breathe for a child. Use the same compression breath that is used for adults. 30 compression followed by 2 breaths. This is 1 cycle. Next is to perform CPR on a baby 4 weeks old and older. Most cardiac arrests in babies occur from lack of oxygen, such as from drowning or choking. If you know the baby has an airway obstruction, perform first aid for choking. If you don't know why the baby isn't breathing, perform the CPR. To begin, examine the situation, stroke the baby, and watch for a response such as movements. But don't shake the baby. If there's no response, follow the CAB procedures. Pillow for a baby under age 1 except newborns, which includes babies up to 4 weeks old. And time the call for help as follow. And the second is, if you're the only rescuer and you didn't see the baby collapse, do CPR for 2 minutes, about 5 cycles, before calling 911 or your local emergency and getting the AED. If you did see the baby collapse, call 911 or your local emergency number and get the AED if one is available before beginning CPR. And the third is if another person is available, have that person call for help immediately and get the AED while you're attending to the baby.
Compressions. Restore blood circulation. Number 1. Place the baby on his or her back on a firm, flat surface such as the floor or ground also will do. Imagine a horizontal line drawn between the baby's nipples. Place fingers on one hand just below this line, in the center of the chest. Number 3. Gently compress the chest about 1.5 inches or about 4 centimeters. Count aloud as you pump in a very rapid rhythm. You should pump rate of 100 to 120 compressions a minute. So effective compressions ensure that oxygenated blood reaches vital organs, increasing the chance of survival. Next is airway. Open the airway. After 30 compressions, gently tip the head back by lifting the chin with hand and pushing down on the forehead with the other hand. Breathing breath for the baby. Number 1. Cover the baby's mouth and nose with your mouth. Prepare to give 2 rescue breath. Use the strength of your cheeks to deliver gently puffs of air instead of deep breath from your lungs. 2 slowly breathe into the baby's mouth 1 time. Taking 1 second for the breath, watch to see if the baby's chest rises. If it does, give a second rescue breath. If the chest does not rise, repeat the head tilt and chin left maneuver and then give the second breath. Number 3. If the baby's chest still doesn't rise, continue chest compression. Number 4. Give 2 breaths after every 30 chest compression. If 2 people are conducting CPR, give 2 breaths after every 50 chest compression. Perform CPR for about 2 minutes before calling for help unless someone else can make the call while you attend the infant. Number 6. Continue CPR until you see sign of life or until medical person arrive. For example, if the baby's chest rises after a breath, proceed with the second breath and continue CPR. Things to remember. For all victims, one person CPR cycle is 30 compression to 2 breaths. 2 people CPR for the adult cycle is 30 compressions to 2 breaths. 2-person CPR for child and infant is 15 compressions to 2 breaths. Pulse check for adults and child is carotid artery or neck. For the infant, brachial artery or arm. Child is 1 year old to 12 years, and adult is 12 years, and over for rescue or care techniques. Conscious check of victim is guided by sample or CFA. Cardiac chain of survival. Early recognition, access to 911, early CPR, early defibrillation, early advanced medical care. So these guidelines ensures effective CPR and improved survival chance. The Emergency Medical Service or EMS system is a network of a community and medical personnel that provides care to victims in medical emergency situations. The system includes 6 resources. Number 1, recognition, response, and care by lay responders. Number 2, early activations of EMS system, or call 911. Number 3, professional rescue care. Number 4, pre-hospital care provided by advanced medical personnel. Number 5, hospital care. And lastly, rehabilitation. The EMS system includes recognizing emergencies, calling 911, and providing care until advanced medical personnel arrive. This coordinated approach ensures timely and effective response to emergencies. Checking the unconscious victim. For adult, child, infant, size up the scene. Check the scene. Is the scene safe? How many victims are there? How could the accident have happened? Are there bystanders who can assist before checking the victim? Put on protective gloves or PPS and get breathing barrier if available. Primary assessment. Check the victims. Do a tap and shout. If no response, summons more advanced medical personnel or call 911. Next is airway. Open airway, head, tilt, or chin left, breathing. Look, listen, feel for breathing and movement for more than 10 seconds. Next is circulation. Pulse check and severe bleeding check for more than 10 seconds. If victims has hyperthermia, check for 30 to 45 seconds. Provide care as needed. Giving ventilations or rescue breathing. Adult, child, and infant open airway or head, tilt, chin, left. If after you check a victim, there is a pause but no breathing, begin giving ventilations. For adult victims, the ratio is 1 ventilation every 5 seconds. For a child and infant victim, the ratio is 1 breath every 3 seconds. Position and seal the resuscitation mask, open the airway, and ventilate into the mask. About every 2 minutes, remove the breathing barrier and recheck for breathing and pause for no more than 10 seconds. Next is if there is still a pause but no breathing, continue ventilations. If there is no breathing and no pulse, begin CPR. For example, if a child has a pulse but isn't breathing, give 1 breath every 3 seconds using a resuscitation mask. Next is conscious choking, adult and child. We have here a size up the scene, check the victim. For an adult, obtain a consent to treat. For a child, then get a permission from parents or guardian. If the victim is coughing, encourage them to continue coughing. If they stop coughing forcefully, summon more advanced medical personnel or call 911. Stand beside the victim. Place your arm under the victim's armpit and across their chest to their opposite shoulder. Lean victims over. Using the other hands, perform back blows between the victim's shoulder blades using the palm hip. Separate and distinct attempts. For a small child, you may need to kneel. Stand or kneel behind the victim. Slide one foot between the victim's feet. Locate the victim's belly button and place the fist just above the belly button, uh, thumb side in. Grab your fist with your other hand. Give 5 quick abdominal thrusts, inward and upward. Repeat sequence of 5 back blows and 5 abdominal thrusts until the object is forced out. Victim begins to cough forcefully victim becomes unconscious. If the victim falls unconscious, guide them to the floor and begin assessment for unconscious choking by checking the mouth for a foreign object. So this maneuver helps expel the obstructions from the airway, preventing suffocation. Unconscious choking. Adult, child, and infant. If the chest does not clearly rise with ventilations, reposition, retilt the head, and reattempt two ventilations. Next, if the chest still does not rise, assume the airway is blocked. For all victims, do 30 compressions. For an adult, compress the chest to a depth in at least 2 inches. For a child, compress a depth of about 2 inches. For an infant, compress to a depth of 1.5 inches. Next is compress at a rate of at least 100 chest compressions per minute. The 30 chest compressions should take about 18 seconds. Look for the foreign object, open the person's mouth, or remove breathing barrier. Next is look in a victim's mouth. If you see an object, remove it with a finger sweep. If you see nothing, do nothing. Attempt 2 ventilations. If ventilations do not go in, repeat cycle. 30 compressions, check or sweep. 2 ventilations, check or sweep, 2 ventilations. If ventilations go in, check the victim for breathing and pulse check. Provide the care required based on the check. So, rescue breathing, CPR, or repositioning and monitoring. These steps are crucial to clear the airway and ensure oxygen reaches the lungs, preventing brain damage or death. For example, after compression, if you see an object on the mouth, remove it with a finger sweep and attempt ventilations again.
Control choking infant, if possible, get permission from the parent caretaker to help while supporting the head and neck. Position the infant face down on your forearm and next turn the infant face up and position on the opposite side. Place 2 fingers on the center of the breastbone, just the nipple line. Give 5 chest compression about 1.5 depth. Continue cycle of back, blue, and chest thrust until the object is forced out or the infant become unconfused. If this happiness, begin procedure for unconfused choking adult and child. CPR. If after you check a victim has to breathing and no pulse, then begin CPR on hands placement. Place the head of your hands just above the notches in the center of the breastbone. Only the head of your hand should be touching the center breastbone. Always use 2 hands. Position your shoulder over your hand. Keep elbow straight and compress straight down at less 2 inch for the and about 2 inch for a children. Give 30 compression at a rate of 100 compression per minute at about 80 seconds. Push arm, push pass. Give red. Continue CPR. Silent of 3 compression and 2 red. Continue CPR for all victims until the patient become unsafe. Your see obvious signs of life, such as breathing more, advise medical help or other infrastructure take over. You are too excluded to continue your heart present with a valid DNR order and AED is ready for use. Infant CPR on hand placement image A done between the kneehole of the infant. Place your ring and middle finger just below the line of the center of the breast. Hold the hands near the victim. Hand will be placed to maintain an open airway. Give 30 chest compression depth 1.5 inches and give rescue breath. Repeat the silence of 13 compression to breath. 2 person CPR. Person CPR. For the adult victim will be 13 compression to breath. Finger placement for the infant. Change to the two thumb technique. Change position on every 2 minutes with minimal time. Loss less than 5 seconds between change. When performing 2 person CPR, the rescuer during the patient will quickly review compression with you and rescuer during the victim will follow then you using an AED and abnormal heart rhythm characterized by total disorganized electrical activities for ventricular fibrillation. The heart cannot pump blood in ventricular fibrillation.
Burns. For all burns, the wound should be cooled by with lots of cold water. This will reduce the continued burning on the skin. Cover the wound with a dry, sterile dressing to prevent infection. Do not use ice or ointment for the burn wound. Monitor the ABCs and monitor for sign of shock. Controlling bleeding. These two basic steps to controlling bleeding are listed below. So always watch victims of bleeding emergencies for sign of shock. Wear gloves to prevent disease transmission. So these steps are done in order and you move on the next step only if bleeding continues. Number 1 is direct pressure. So apply dressing to the wound and press down firmly. Second is pressure bandage. Apply additional dressing and wrap with ruler bandage. Tie a knot directly over the wound for additional pressure. If the bleeding continues, make certain 911 has been called and additional dressing and wrap another roller bandage around the wound. Standard first aid. Checking the conscious victim. Check the scene for safety. Then check the victims for any life-threatening conditions like unconscious, difficult, or no breathing, no pulse, and severe bleeding. If any of these are present, call 911. For any conscious victim, always get permission to help. Take precaution against the transmission of disease or wear gloves. Ask the victim, what happened? Are you feeling pain, numbness, or tingling anywhere? Any allergies? Are you taking any medications? And when did you last eat or drink anything? Do a visual check of the victim from head to toe. Note any bruises, bumps. Look for bleeding, sweating. Is the skin pale or red? Look for sign of pain or trouble breathing. Look for sign of shock, rapid breathing, and or pulse, nausea or vomiting, skin color pale or sweating, restlessness, and any blue tint to the skin. So, ensuring safety and understanding the victim's condition helps provide effective and appropriate first aid, preventing further harm.
Heart attack symptoms. Chest pain or discomfort, often prescribed as pressure, squeezing, fullness or pain in the center or left side of the chest. Pain or discomfort in other areas of the upper body, including one or both arms, the back, neck, jaw, or stomach, shortness of breath, cold sweat, nausea, or lightheadedness. First aid care. Call 911. Immediately call for an emergency medical help. Chew and swallow an aspirin. If the person is not allergic to aspirin and is not told by the doctor to avoid aspirin, help them chew and swallow a regular strength aspirin to thin the blood. Assist the person to sit down and remain calm. Keep them calm and seated while waiting for emergency services. CPR. If the person loses consciousness and is not breathing, begin CPR. Use an AED if one is available and follow the instructions provided. Diabetic emergency or hypoglycemia symptoms. Shakiness, sweating, hunger, irritability or confusion, rapid heartbeat, pale skin, weakness or fatigue. First aid care. Give sugar. Provide the person with a fast-acting source of sugar, such as glucose tablets, fruit juice, regular soda, or sugar dissolved in water. Recheck the blood sugar. If possible, check their blood sugar level to confirm hypoglycemia. Monitor and repeat. If symptoms do not improve in 15 minutes, give more sugar and recheck blood sugar levels. Seek medical help. If the person does not improve after taking sugar, or if they lost consciousness, call 911. Stroke symptoms. Sudden numbness or weakness in the face, arm, or leg, especially on the one side of the body. Sudden confusion, trouble speaking, or difficulty understanding speech. Suddenly trouble seeing in one or both eyes. Sudden trouble walking, dizziness, loss of balance, or lack of coordination. Sudden severe headache with no known cause. First aid care. Call 911 immediately. Time is critical in treating a stroke. Note the time. Observe and note the time when the symptoms first appeared. This information is crucial for medical professionals. Keep the person comfortable and still. Help the person sit or lie down in a comfortable position. Do not give them food or drink. Monitor symptoms. Stay with the person and monitor their condition until emergency services arrive. Cold emergencies including hypothermia and frostbite occur due to prolonged exposure to cold temperatures. Here are the symptoms and first aid care for each. Hypothermia symptoms: shivering, slurred speech or mumbling, slow, shallow breathing, weak pulse, clumsiness or lack of coordination, drowsiness, or very low energy, confusion or memory loss, loss of consciousness. First aid care: move to a warmer place, get the person indoors or to a sheltered area protected from the wind and cold. Remove wet clothing, replace wet clothing with dry, warm blankets or clothes. Warm the body, use dry blankets, clothes, or your own body heat to warm the person. Place warm, dry compresses on the chest, neck, or groin. Do not apply direct heat as this can cause skin burns. Provide warm drinks. If the person is conscious and able to swallow, offer warm, non-alcoholic, caffeine-free drinks. Monitor and seek medical help. Call 911 and continue to monitor the person's condition until helps arrive. Number 3, frostbite. Symptoms: cold skin,